My name is Mike Forster. I'm one of the medical examiners in the Trust, and I'm here to talk to you today about the process of death certification in the Trust, which you will be doing as part of your day-to-day job as a junior doctor here. I hope to outline what the medical examiner service is and what we expect of you as junior doctors in completing the medical cause of death certificate and the cremation paperwork in a timely fashion, so that we can get it to the families and bereaved relatives as quickly and as efficiently as possible. So for today's session, I hope that you'll be able to understand the role of the Trust Medical Examiner Service and recall the process for doctors regarding death certification, and that you know what to write on a death certificate. So who are we? Well, we're the Trust Medical Examiner Service. We were established in April 2020 by NHS England, and although we work for the Trust, we're completely independent to the Trust and therefore provide independent scrutiny of all the deaths that happen in the hospital, and that's both in the hospital in Derriford, in Mount Gold Hospital, in Tavistock and in Kingsbridge Hospital. We're also soon to review all the deaths in the community as well, so from October to January time this year we'll be reviewing all the deaths that happen in the wider Plymouth area. So we're led by Dr. Jonathan Cope. He's the Assistant Medical Director for Primary Care here, and he's also our lead medical examiner. There are also currently 3 other medical examiners: Dr. Burbridge, Dr. Haravi and Dr. Forster, myself, and we're supported by Lauren and Zoe, who sit in the office all the time. You'll find a medical examiner in the medical examiner office every day between 1 and 5, and the medical examination officers cover every day from 8 till 4. So there's always somebody around in the office in daytime hours for you to talk to if you've got any questions or queries. So we essentially, as I explained, we scrutinise all the deaths in the Trust, and we look for patterns in deaths to report back to department. So if we see that there's been a problem with the care on the ward, or there's a particular issue with care, then we can report that back and induce the Trust to do an investigation to sort out what's needed, if there's changes needed in the care provided or changes in particular processes. Then the medical examiner service can be quite instrumental in helping to sort that out. So this slide just explains what happens after somebody dies, really. A doctor would confirm death, and this is important that a time of death is written in a note. So when you're on call, in the night that the nurse phones say somebody's died, you go to the ward and make an entry in the notes to confirm their death. So the next morning, those patients' notes would sit on the wards. We'd then expect the doctor who was looking after them, or one of the ward doctors who is on the ward, to have a look through the notes and attempt to complete the medical cause of death certificate. In the meantime, our team would contact the family and ensure that the family didn't have any concerns about the death. And following the family giving that information and your death certificate coming in, all that information will be collated together and sent to the medical examiner for review. So what we do then is we sit in the office, we look at the notes, your death certificate and your cremation form, and we go through it. We ensure we agree with the cause of death, that we agree with everything that's been said, and there's been no concerns raised by the family or concerns raised by any of the clinical team about the care received. And providing that's okay, we will then sign off the death and forward it to the registrar, who will then register the death with the family, usually the next working day. So the Trust has 5 days in which to complete this process. So from the date of death, it's 5 days till that day. That doesn't include weekends. So if somebody dies on Friday night, we've already lost 3 days by Monday morning. So it's really important that it's done really quickly and efficiently, particularly after weekends or bank holiday periods, because sometimes after a bank holiday period we can only have a day left to complete the death, and the Trust aims to send about 95 to 100% of them to the registrar within 5 days. So going through what you have to do, you need to complete the death certificate and preparation form immediately, usually in the morning as soon as you've known where your patient's died. Hopefully, but you'll have done that by 11 o'clock in the morning. We understand that it can be difficult to prioritise things like that on a busy ward environment, but it's important for the family that they get the paperwork done and they get it quickly. You need to provide us with a contact mobile or bleep for the next 48 hours, particularly if you're going to be away, so that we can contact you if there's a problem with the death certificate or we want to find out some more information, and be available then to discuss that death with the medical examiner. And as I said, the Trust only has 5 days to send the certificate, so it's important that this is done in a timely manner. So what do we expect on the medical cause of death certificate, or the MCCD? We hope that it needs to have the patient's full name and date of death at the top and their age. It needs to have 1A is the cause of death, the thing that caused their death, what directly led to them dying. And this can't be a mode of dying, so you can't write things like cardiac arrest, respiratory failure in part 1A without qualifying it with something else. But if you qualify it, that's okay. So it's okay to write cardiac arrest in 1A if you put myocardial infarction in 1B. So going on to that, 1B and C are conditions that led to 1A. So, for example, you could write sepsis in 1A, caused by urinary tract infection in 1B. Section 2 contains other things that were in the background that didn't cause the death but contributed to it. So it might be the patient had diabetes and hypertension, which you didn't think caused the death, but you thought were contributing factors, and they should therefore go in part 2. There must be an interval between illness and death, and then circle on the back whether you discussed it with the coroner or not. You need to complete the back of the certificate, the counterfoil, and the bit on the side that says notice to informants. And this next slide really just shows the death certificate as it stands, and this is what you should see. What do we refer to the coroner? Well, we refer any death which is unnatural, and that's done via the Trust form on the website. So we're happy to give advice in the office on this. Which deaths do you refer? You can get this form from the bereavement pages of the hospital website, complete it, and also send it to the bereavement team as well, so they're aware that this is happening. And remember to complete the death certificate based on your view and not that of your senior. We do get a lot of people who say, well, the consultant told me to write this, or the consultant said the cause of death should be this. If you're at all in doubt of what should go on that death certificate, please discuss it with the medical examiner service, because we'll be able to provide an independent view of and advice on what needs to go on that certificate. Okay, so I'm just going to talk now very briefly, just to take you through a case of completion of a death certificate. Just so that you get some idea of what you need to do. So I'm going to put a scenario up on the screen, if you can just think about this and what happened. So Alfred Brown, he's 85, he lives in a nursing home and he has dementia and ischemic heart disease. He's confused, he's spiky at temperature, he had a fall but no injury, and clearly he's got a pneumonia on his x-ray. His COVID swab is negative. He's seen the next day on the ward round, and you look after him on his first night. He gets worse, his blood pressure becomes unrecordable. The medical consultant diagnosed sepsis and decides that he's too ill to survive. He's given last days of life care and dies at 23:10 that night. And you, Dr. John Adams, in this scenario, have been called to confirm his death, and you confirm it 00:20 on the 27th of June. So think about what this says. So you refer him to you think about referring him to the coroner because he's had a fall, but the coroner's happy that there's nothing that they need to do because the fall didn't contribute to the death. So if we think about how we might complete his death certificate, this is an example of how you'd write the full name. So his full name's there, his age is there, the place where he died is there. We then fill in dates. So remember, the date of death is the date he was certified. So this man died late in the evening, but he wasn't certified to the early hours of the next morning. The date of death is recorded, and this is slightly different to the time recorded by the nurses. And remember that the date you last saw the patient arrive should be 14 days in normal circumstances. Currently it's been extended because under the COVID Act to 28 days, and in fact in subsequent COVID rules you don't actually have needed to see that patient before they died to complete. Any medical practitioner can complete the death certificate. So if we think about what digits we need to ring on the next section, we need to ring that another medical practitioner has seen the patient, and we also need to ring that we had discussed him with the coroner. So in this case we would ring B because your colleague saw them, and we would ring 4 because we discussed it with the coroner. And this is what the death certificate looks like so far. So then we need to think about the cause of death. We need sepsis clearly in 1A, and the sepsis was caused by pneumonia. We might want to put the dementia and ischemic heart disease in part 2. Remember to complete the employment box if employment contributed. Was this working with asbestos or shipbuilding, which is common in Plymouth? And sometimes if there's respiratory disease here and you think they've been caused by asbestos, then a coroner's referral would be appropriate. Remember to sign the bottom of the death certificate with your name, your qualifications, your GMC number, and make sure your telephone number is supplied with the certificate. And write the consultant's name and date the certificate the date you signed it. Remember to complete the other side, which is a notice to informant, and you just need to write the patient's name and sign and date that. If you turn over the certificate onto the back, you'll see an A and a B box. B is rarely completed, but A needs to be initialed if you've discussed it with the coroner. So thank you for listening to our presentation. We're around and available all the time for your support. So there's someone always in the medical examiner office, and in the afternoon it's staffed by a medical examiner as well. We're always able to give advice on what to write on death certificates, when to refer to coroners, and give general advice about death certification and the process in the hospital. Come and find us. We're found just by the doctor's mess. So if you walk past level 7, just past the cashier's office, rather than going right to the doctor's mess, you just turn left and our office is just there. So come and see us. You can also phone us. We're available on extension 38342 every afternoon, and we'll be happy to discuss with you. And thank you for listening, and I wish you all the best for your new job in Delford.